As communication leaders, we know the importance of technology, specifically data collection, and how it can bring forth improvements to our day-to-day living, whether it is for healthcare, infrastructure, information, or communication. Nevertheless, with great advances in data collection come great ethical responsibility. For this very reason, communication leaders must set forth processes and policies that coincide with ComLead's core declaration tenet technology of respecting data collected from any entity, whether it is a nation, individual, or a corporation, and assure that this data is administered with the utmost integrity. Data integrity is the upkeep and the assurance of the accuracy and consistency of data over the entire life cycle. To ensure data is recorded exactly as intended and upon later retrieval, ensure the data is the same as it was when it was originally recorded. In short, data integrity aims to prevent unintentional changes to information. The focus of this paper gravitates around the issue of data ethics, particularly data integrity for common diseases in the African nation of the Democratic Republic of Congo. Many flaws can exist in the big data sets collected in the DRC generated by the World Health Organization and the UNICEF platforms, from personnel qualifications, preparation and execution, data collection, and data maintenance and archiving. No data is immune to these integrity issues. These can occur anywhere in the data generation. These oversights, when not administered properly, can ruin not only valuable research, but also can be detrimental to the country's strides in improving their healthcare system. The Democratic Republic of Congo sits on 80 million hectares of arable land and over 1,100 precious metals and minerals. The country is the largest exporter of diamonds in the African continent, but the poorest in the world. The DRC ranks 176th out of 189 nations on the UN's Human Development Index, and over 60% of the 77 million DRC residents live on less than $2 a day. The country has witnessed and survived the external war, political inefficiency, and economic exploitation, which have hindered the country's ability to combat poverty and fight diseases such as malaria, diarrheal diseases, measles, and cholera. But diarrhea and cholera in the DRC stem from a lack of adequate sanitation and safe water. In the DRC, less than 25% of people have access to clean water, and cholera outbreaks occur frequently. Both the UNICEF and the World Health Organization, WHO, have been at the forefront of big data collection for DRC. They utilize data mining to collect data. Data mining is a process used by companies to turn raw data into useful information. This process can detect anomalies, patterns, and correlations with large data sets to predict outcomes. They have collected data over the years that can be utilized to locate patterns and trends that occur in the past that can be applied to predict a better outcome and better information. The Congolese government, UNICEF, and the World Health Organization, WHO, have taken strides in improving the quality of healthcare in the Democratic Republic of Congo. For instance, with their data, we can detect and locate the number of outbreaks of measles and its progress since 2017 and 2019. Data is helping many African nations, including that of the DRC, in accurately distributing health resources to affected regions where common diseases have a stronghold. Nevertheless, data integration issues can distort the validity and accuracy of the data presented by both UNICEF and WHO. Common problems seen in each portion of the process that can contribute to data integrity issues include PPDDA, personnel qualifications, preparations and execution, data collection and archiving. In terms of personnel qualification, DRC needs specialists who are proficient in big data techniques. Universities on the continent need to start teaching how big data can be used to find solutions to scientific problems. A sophisticated economy requires specialists who are skilled in big data techniques. The DRC, due to the lack of qualified personnel, not properly preparing personnel to generate or review data, can have a big impact on data collection that may contribute to the integrity of the data. personnel using improper techniques due to inadequate training, lack of oversight, or technique slippage, management focusing on thorough input over accuracy integrity of data, personnel engaging in active fraud, falsification activities. Task preparation and execution. Due to lack of funding by DRC's government, data integrity can be distorted because of the following: accuracy, reliability issues with systems and equipment, including data acquisition and recording systems, such as failing to calibrate, validate, or provide appropriate access controls to the system's equipment, not labeling materials, samples, or processing equipment appropriately, leading to errors and mix-ups, especially when dealing with diseases, not providing enough detail in procedures to enable consistent performance throughout data capture, collection, or appropriate verification and oversight. Data collection. This accuracy, reliability, and timely data has been a recurring issue in the DRC. In fact, in most sub-Saharan countries of Africa, it continues to be a major constraint to the effective monitoring and evaluation of interventions and development programs across countries in Africa. Strides have been taken in ameliorating the frequency and quality of census surveys in the past 3 decades. Nevertheless, estimates on health and other socioeconomic outcomes are often uncertain and are not systematically produced. Data accuracy can be undermined when determining birth dates, deaths, sickness, safety, etc. Opportunities that may arise are as follows: mishandling, covering up, or failing to report deviations, inaccuracies of data, overburdened personnel, not performing thorough reviews of data, personnel documenting work that wasn't even completed, not following procedures leading to inconsistency in data collection/interpretation. Data maintenance and archiving. Data collected by both UNICEF and WHO are both subject to DRC's governmental rules. Thus, the data collected by both platforms may be lost due to failing to back up data or protect records from loss, altering, overriding, or deleting failing data, hybrid systems lacking processes to manage and maintain both the paper and electronic components of the system, retention of raw data of the complete data acquired or generated during a process. When done ethically and effectively, big data collected by UNICEF and the WHO can benefit healthcare providers in all Congo regions, such as hospitals, clinics, physicians, and patients, by adopting new technologies, which will help early detection of common diseases, in fact, any life-threatening disease. Nevertheless, a strong emphasis should be implemented in personnel qualifications, preparation and execution, data collection and archiving to avoid data integrity. To avoid data integrity, UNICEF and WHO need to ensure to educate government officials of the DRC on the expectations for data integrity and ensure their procedures have the appropriate controls in place to protect against data integrity issues throughout the country. Data collection should be administered ethically and consciously. Any Congolese official that works or inputs any information to the data should hold him or her principles of integrity, accountability, and transparency, and ensure that this data is administered with the utmost integrity.